Good evening. Welcome to our Public Health and Health Promotion Masters webinar. Thank you very much for attending today's webinar. Just before we start, if you do have any questions you'd like to ask about the webinar, please type them in the question box and we will answer them at the end of the webinar. So without further ado, I'd like to pass over the mic to our Public Health and Health Promotion lecturer, Dr. Nana Anokye.
Yes, thank you very much, John. And I'd like to say a hearty welcome to the webinar on public health and health promotion. My name, as John said, is Nana Anokye, and I'm the course director. So I have the pleasure of taking you through, at least for the next 15 to 20 minutes. First of all, I'll take you through the context of this course. And then I'll tell you about the aims and the structure of the course, as in what you expect in terms of the study blocks and assessment blocks. Then I will tell you about the timetable so that you can start planning already. And then finally, I'll aim to answer the very big question, which is the and so what, as in what are the employment opportunities, which is I think what you might be thinking of now. As John said, there will be time for asking questions right after the presentation. So as you could see, I sometimes want to refer to this course as a family. It's not a team, it's a big family. And as the picture you're currently seeing rightly encapsulates. So this picture was taken at one of our events. So we tend to run social events, as you could see. We've got our lunches right on the tables. And this was one cohort. So you could see a very diverse group made up of students from different parts of the world. And that is the makeup of the course. So as we hopefully welcoming you into this family, the expectation is that you come and you be part of this big family. So our course sits in the Division of Health Sciences. The Division of Health Sciences is a multidisciplinary division made up of public health, health promotion, and health economics. And in terms of research profile, we've got a very strong research profile. So the research we do tends to cover areas of health economics. We are also very research active in aging studies, welfare, health, and well-being. And I'm glad to say that the staff on this course are academics who sit on committees and panels, and these I'm talking about national and international committees. So you come here and I'll show you the lectures will be delivered by research active staff members who have great international profile. Now, how was this course developed, and that is what I'm going to pick on next. So the course has been developed. The development, of course, was informed by a range of subject disciplines, including global public health, health promotion, epidemiology, and other social sciences, including geography, sociology, and psychology. In addition, we've included principles, perspectives, and practicing health promotion in this course. The aim here is to advance your skills and knowledge in these areas. In terms of the practical side or the research side, we aim to support you to learn the diverse methodologies that you need to engage in research. And this includes statistics, qualitative analysis, quantitative analysis, media, and systematic reviews. In doing all this, our intentional purpose, we try as much as possible to link theory to policy, so that when you leave this course and you go out there, it's not just about the theory, but then you will know how to apply this to real life practice. The aim. I might have captured most of this already, but then just to reiterate, our aim is to investigate, to inform students so that they could be able to investigate the scope and nature of contemporary public health, and also to help you explore the major determinants of health, to build your skills and knowledge around reflective practice, and to explore a multidisciplinary approach to public health and health promotion. By doing this, we aim to examine the ethical, political, societal, and cultural dilemmas that arise, obviously, when you are looking at public health and health promotions. And at the end, when I come to when I tell you about the study blocks and the assessment blocks, you can see that at the end, we have an empirical research project that every student will do. The plan here is to bring all this knowledge together in a real life or to answer a public health question. So what are the study blocks? There are 9 study blocks, and these study blocks first start with global public health. You also have a block on health promotion, health and society, evidence and communication, which is expected to inform or support you to communicate evidence from research to policymakers or to other audience. You also have the health policy, politics and social justice, and then implementing change, which is set out to help you assess or evaluate quite robustly a public health intervention. On the right-hand side of the slide, you could say that there are 3 main blocks, and these are the main research components of the course. And they include approaches to research methods, which is a generic model that informs you about how to conduct statistical analysis using SPSS and other statistical softwares. And then you have research in practice. Research in practice as a study block informs you about data collection. So the main types of collecting data, including developing a survey to collect quantitative data, developing things like focus groups, to collect qualitative data, and also how to analyze these data. So there will be things like how to conduct thematic analysis, how to run regression models using SPSS software, how to do bivariate analysis, and a host of other statistical analysis. And then finally, all the knowledge gained here, our expectation is that you use that to construct a question of interest. Now, the interesting part of the dissertation model is that you have the opportunity to come up with your own question. In addition, we also use this as a platform to help students interact with potential employers. So there will be questions coming from potential employers, and in case you are interested in one of those topics, then that will be the beginning of your interaction with these employers as you work on that particular topic. So given these study blocks, these study blocks then map onto assessment blocks. We've got 7 main assessment blocks, and these include 2 examinations and 5 coursework or submissions. Then in addition, you have your dissertation, which you submit. So if you are doing the course on full-time basis, your dissertation is usually expected at the end of your program. Overall, your assessment blocks will lead you earn you 180 credits, with the dissertation carrying 60 credits and the other taught modules carrying 120 credits. The student profile. As I already showed in the first slide, our students come from diverse backgrounds, ranging from professionals working in health and social care, local government, education, and the voluntary sector. And in terms of the subject profile or the academic background, most of your classmates will be coming from health sciences, social sciences, biosciences, biomedicine, or even from the business economics. So it's quite a diverse group. And what I do say to students is when you come here, in this family, you not only get a benefit of learning from staff with diverse background, but also learning from colleagues with diverse backgrounds, both in terms of environment or context, as well as academic backgrounds. Then if you plan to do the course on a full-time basis, the expectation is that you do this over a year. So if you start in September, the expectation is that you complete the following September. If you plan to go for part-time, the expectation is you have up to 3 years. That doesn't mean you complete, you can't complete before 3 years. So we have specific occasions where students on part-time, the part-time students have completed their course within 2 years. So there is a possibility to finish earlier than the 3 years. Teaching usually occurs over 3 days. For part-time, we are talking about 1 to 2 days. Next, I'm going to give you a brief overview of what to expect in terms of the timetable. So this timetable I need to emphasize is based on an example, an example of last year. So this year timetable, we are still working on it, but our plan is to maintain this very pattern. So assuming that works out, then the expectation is, if you're a full-time student, you come in and you attend lectures on Tuesdays, Wednesdays, and Thursdays. We expect that you will use your Mondays and Fridays to engage in independent learning. For part-time students, for year 1, you attend lectures on Tuesdays and Thursdays, and for part-time students, year 2, you attend lectures only on Wednesdays. Now, you have the opportunity of having your own timetable delivered to you via your e-vision. It will be online. So each morning, you have the opportunity of seeing your own timetable. So given the mode of study, you realize that the timetable might be a bit different than what your colleagues who are saying on full-time. If you're on part-time, you see a difference there. Any changes in timetable will be communicated to you via our platform, which is the Blackboard platform. The big question. I know you might be thinking, what is in this for me? Why should I do Masters in Public Health for promotion? What kind of career opportunities does it offer? Just before I tell you about that, I would like to let you know what we do to support our students to present themselves well or to put themselves in a good opportunity to get work. We actively organize an annual employability event each year. And what we do on that day, which is half a day, is that we invite employers from multinational organizations. So we have employees coming from places like DFID. You have employees coming from local organizations like the NHS, and you have employees coming from charity organizations as well. Now, the intention of that day is that day opens with presentations by the employers to tell you what they expect from potential applicants. And then after that, the second part will be kind of some speed dating. What we do is that we have a round table, a series of about 4 or 5 round tables, and the employees will be sitting around the tables, and each student will have the opportunity of talking with these employees to ask them. Now we have examples of students getting offers at these events. So this particular year, I remember one student after that event being given an offer, which is up to them to take it up. So these are some of the things that we do. In addition, we have a careers consultant, a very good one at that, who is on campus and is really at your service. So if you have any questions relating to how you're going to do an interview, how you're going to construct or develop your CV so that you sort of present yourself really good for the employers, we have a careers event who can take you through that. And then we have one module which is it's got 0 credit, so it means there is no associated assessment block. This model aims to teach you transferable skills. So how do you make presentations? How do you do when you go to interviews? How do you network? What are the kind of small talks you engage in when you meet potential employers? So we do offer all these in the course, and the plan is to prepare you for future, or to prepare you for employment. Now, so given all this, the question is, where can you find yourself to be working after this course? Our expectation, or the expectation, is that you work in an organizational development. So that will be developing organizations to be more health promoting, and this could be in schools, workplaces, and hospitals. You could also work in community development, where you'll be developing communities to be more health promoting, and here I'm talking about cultural communities or communities of interest. And then you could work in strategy development, where you develop strategic approach to improving health and ensuring that national or local policies can affect public health in a health promoting way. Then you can also work in partnership development, health information, as well as project management. What are the destinations of previous students? So our previous, these are just examples that I provided. Our previous students, or students on this course, after the course, tend to find themselves working in healthcare management services, charities, NHS. Some decide to go on and do their PhD. So one of our previous students is currently a director of both healthcare. One of them is a health advisor with Providence Center, and we have a number of them working in the NHS, as well as doing their PhD or working as research and development coordinators. So this is where you're likely to find yourself in after this course, but I need to emphasize that this is not exhaustive. So it really depends on where you want to find yourself. And let me bring you back to what I did mention earlier, that you could work in organization development, community development, strategy development, partnership development, health information, and project management. So it's really a matter of choice. So this brings me nicely to the end of my talk. But as I always say during these webinars, that the plan is, this is a process, not an event. So today marks the beginning of our interaction. So you could see here my contact details. You could contact me by phone or through email, or you could also contact the course administrator, who is Mr. Daniel Ryder, and you can contact him through his email or phone number as well. So keep the questions coming, and we will be glad to answer them. Thank you.
Thank you very much for that, Dr. Anokye. So very, very insightful presentation. So like you said, if you do have any questions, please type them in now, and we'll certainly endeavor to answer them for you. Just a couple of things prior to answering your questions. If you do have any specific questions about the course, the contact details on the screen, you're more than welcome to email either of those gentlemen and answer questions. But if you do have specific questions, and if you actually already have enrolled onto this course and you do have specific questions not directly relate to the content, e.g. your admissions or anything like that, you can email our admissions department, and their email address is admissions@brunel.ac.uk. That email address again is admissions@brunel.ac.uk. And we will also make a copy of this webinar available on our YouTube channel, and it should be live on there in about a week or so's time. So without further ado, let's take some questions from the audience. So we have some interesting ones here. We'll start off with Gaujel, who's asked, hi. Oh, actually, it's a slightly different name here. So this is Kelly from Singapore, who asked, may I ask what kind of job I may get after I graduate from Brunel University? And is it possible to find part-time jobs during my school time related to public health or health promotion? Quite an interesting one there.
Yes. Okay, so to answer, I'm taking you back to one of the slides. So as I said, there are multiple opportunities available, but I'd like to answer your question in this way. So what do we do to support you to get those jobs? So as I said, we provide two platforms. Number one is you could, so potential employers will send in potential topics for dissertation. So once you choose one of them, then that presents the gateway for you to start a relationship with those employers. Now, Brunel also provides, so there is a job shop here on campus which provides multiple job opportunities. Now, so given the specification of your visa, then you have the opportunity of finding yourself a job. And then staff also, so we tend to send a number of job opportunities to students as well. So I would say in terms of job prospects, this is a very good one. I always say to myself, I probably should have done this course, during my master's. My master's wasn't into this because the job opportunities and employability events are fantastic. It's not because I'm the course director, but this is the whole Brunel thing. We look after our students very well in that perspective.
Fantastic, thank you very much. So we'll take our next question here from Iman, who asked, when applying, what would be worth including that would help a successful application?
So first of all, so the application, I would like to put it into two main components. The first component is demonstrating or providing evidence of your academic profile, i.e. your first degree, what was the grade point and all that. And also, most importantly, the second component is where you give your statement of purpose to tell us why do you want to do this course. So it's your motivation. What do you intend doing after this course? What are your plans? So tell us. Our expectation is that those plans are obviously related to public health.
Okay. Thank you, Dr. Anokye. So we have another question here from Sam, who asked, postgraduate courses normally include a lot of research-related information in the lectures. Is there any examples of research that you've carried out or lectures that Brunel University have carried out which is included in the teaching?
Yes. Our teaching is research-led, and we do this, as you said, to relate theory to practice. So I'll give you an example. There is one of the models I mentioned, which is evidence and communication, that I'm actively part of. And that's in that model, we tend to support students to acquire knowledge about how to conduct systematic reviews. And using that particular, and as part of this, you also teach you how to identify data sets, how to write abstracts. So a number of research that I've conducted, some with my PhD students and some alone, and these have been published in international journals like BMJ, Open, and etc. And in your course, in this particular model, so you see relating what you've learned to some of these publications. And sometimes you do this by sitting in groups and reading or reviewing those publications and critiquing them to understand what are their strengths and weaknesses. So in short, we make our teaching not just on that particular model, but on all the models very research-led.
Thank you. We have another one here from Sam, so I'll just answer it. It's again based around teaching. So Sam would like to find out about the teaching facilities at Brunel. Is it mostly classroom-based teaching, or do we have bespoke facilities, or is it off-site training, or just around that area really?
Yeah, so it's a number of them, it depends. So when you are doing a practical model, so for example, you're doing something on statistical analysis, then your teaching will be held in a lab where each person will have a computer and will have the software. For example, if we are doing something related to SPSS, you have SPSS installed. There is a big screen which the facilitator will be using, so we'll be taking you through the commands. So it's practice-based. You have the software in front of you and you're doing it. In addition, we know that as students, you may want the possibility of working on these softwares whilst you are in your hostels or your homes. So you also have these softwares downloaded onto your personal computers as well, so you can work on them. Normal, some of the teaching also take part happen in the lecture center. So we have a big lecture block, which is a very sizable lecture center where you sit comfortably. There is enough space for you to get the lectures. We try to spread the lectures around campus as much as possible. The idea here is to give you a feel of campus to also help you network so that you only don't get access to students or mates on your course, but other students as well. And it's all for the common good. Some of the, we also have some events, which I actually forgot to mention. As in addition to the lectures, we also organize social events. So each term we have what we call the international lunch. What this international lunch does is that you could bring in your own food which represents your culture. So all your mates will bring variety of food representing their cultures, and then we all sit down, eat together as one family. And in the course of the eating, we also talk about what are the things that we as staff can do to support students well. So what are some of the challenges you are facing? We expect that occasionally there'll be one or two challenges as you are settling in the new environment. So we engage with you through those lunches to find out what we can do best to support and make your life on campus really, really better.
Thank you very much. So we have a question here from Sheena, who asks about the dissertation in terms of what kind of academic support there is with the dissertation, and could Dr. Nana offer some examples of some previous dissertations?
Yeah. So Sheena, thank you. So for dissertation, each student gets allocated a supervisor. Now, the supervisors will be with you right from constructing your research question through to writing and submitting your dissertation. Now, that's not the only support we provide. I also run dissertation workshops, and some of these workshops include 1-minute presentations. So what we do is that we try to support students at each stage of the way, each of the key stages. So right now, dissertation, the key stages are developing your research question, conducting your literature review, collecting your data, analyzing that data, and writing it up. Now, we have workshops at each of these stages to support you because you're writing on different topics. You may have different challenges. How do you go about addressing these challenges? We are there, in addition to what your supervisor will tell you, to also provide additional support in that regard. So there is a number of opportunities that we provide. What I've mentioned to you so far are the subject-specific support. In addition, we also have the ACT team. So we have a team here on campus, which is outside of the course, and they'll provide you support with regards to data analysis. So if you are using SPSS to analyze your data, then the ACT team runs weekly sessions where you could just drop in sections on how to run your analysis on SPSS. So if you're having problems with some commands, if you have problems with your software not setting up well on your computer and all that, they are available to provide you support. And not just drop-ins, you can also drop in questions to them or to any of the staff members at any point in time, and we'll happily assist.
Excellent, thank you. So we'll keep the webinar open just a little bit longer, so if you have any questions, this is your chance to ask them. So we'll give you another minute to ask any questions if you have them. In the meantime, I'll just reiterate some of the points made earlier. So if you have applied for a course at Brunel University, hopefully this course, and you have any sort of non-course related questions you'd like to ask, please email our admissions department, and the email address again is admissions@brunel.ac.uk. That email address again is admissions@brunel.ac.uk. And once again, there will be a version of this webinar available on our YouTube channel in about a week's time. Okay, so we don't have any further questions. Thank you very much for attending today. We wish you all the best in the studies.
Okay. Thank you very much, and hope to see you come this September on campus.
Fantastic. Thank you. Bye-bye.